Erev Tov. This is TMS Roundtable Israel. My name is Dr. Tova Goldfein, and I am always happy to be here with my co-host tonight, Dr. Ishai Friedman. We have a special guest, way more special than President Biden, here in our Israel studio. Yes, way more special than President Biden. In our Israel studio, Dr. Howard Schubiner, it's a Shehekianu. We do a blessing on a first time, but we'll let go of the blessing for now. Anyway, welcome and thank you for your hour. It's in the afternoon in Michigan, and we are blessed to have you here sharing with us. There'll be some translation or interpretation. I'll speak, or you'll speak, or Ishai will speak, and then we may interpret a little bit to Hebrew. So you may remember your bar mitzvah.
Well, it seems like I've been in Israel a lot lately, even though I haven't left Michigan.
Yeah, well, you're getting very popular here.
Yeah.
So anyway, welcome. And Dr. Ishai Friedman, who I always say we share the same sky, we share the same mission, we share the same passion for helping people with neuroplastic pain. And I'm blessed to be working with Ishai.
Yeah,
so
it's It's great to be here. It's really, really great to be here. And also, thank you so much for asking me to come and host this with Howard. It's very, very special to me. And the influence that you have, Howard, on my personal and professional life is immense. And I appreciate that very much. אני רק אגיד כמה מילים לקהל שלנו בעברית, שאנחנו ממש מתכבדים ונרגשים לארח פה את האוורד שובינר, דוקטור האוורד שובינר, שהוא פורץ דרך בכל רפואת גוף ונפש. So we're really happy to have you. Really happy to have you.
Yeah. It's great when you say one thing and then the translation is this long.
I just said
Israelis, they want everything fast. Meher. So Ishai, go ahead and ask that. We had a discussion before. Ishai had a very interesting question for you. And if we ask you anything you don't want to answer, just kick us under the table and say, I don't want to talk now.
Because I thought it'd be interesting to just listen about a little bit about your past professional career, how you got outside the mainstream system. I know you practice internal medicine and pediatrics, and what brought you to turn the other way or to combine the two? Or it's kind of interesting to me to hear a little bit more about the influences you had.
Yeah. Well, I was really interested in mind-body medicine when I was at University of Michigan back in the early 1970s. So that's kind of have almost come full circle now. I turned away from that kind of work of meditation and hypnosis and acupuncture. I did a lot of that kind of stuff back in the day. And then I just started more of a traditional medical career, and I was at Wayne State University and the medical school there, and I was working and teaching and doing some research in a variety of areas that had a lot to do with mind-body medicine, but often they had to do with behavioral medicine and understanding people. I worked a lot with adolescents. I worked with adults with ADHD. We did some stuff with people with substance use disorder. And then in 2002, I was introduced to Dr. Sarno by reading one of his books that someone told me about. And I read it, and it just rekindled all those old ideas, the old thoughts that I had, and must have been almost, it's sad to say, but almost 50 years earlier. Excuse me. And I just got really interested in that. And I was at a crossroads in my career, and I was just looking for something new and interesting to do. And I just started following that path, and it just one thing led to another. And it's been almost 20 years now that I've been doing that work. And really...
was it something about your childhood I remember I listened to one of your talks and you mentioned something about what your mother taught you. And she raised a mensch, as we say. You're a good man. You know, all those books you wrote and all those research papers. Dr. Schubiner, you're just a good, solid, nice man.
Thank you.
So was there anything in your childhood that kind of opened your heart and mind to this work?
Well, I don't know the answer to that specifically, but I do know that when I was almost 3 years old, my sister was born, my younger sister, and I was the oldest child. And when she came home from the hospital, I started stuttering.
Wow.
So I had a mind-body condition. I think I was used to being the king, or at least the prince of our household, and having this intruder wasn't really to my liking. And my mother was really fantastic because she realized that when I would try to talk, I was stuttering, but when I sang, I didn't stutter at all. So she just sang with me. And we sang our way out of stuttering, and she was just a wonderful, wonderful mom. And, she just imbued me with a lot of confidence and a strong sense of self. So that's really helped along the way.
So we can thank your sister for coming in the world. That gave you a little intergenerational trauma that you became this kind of doctor. Ishai had some kind of experience like that because, Ishai came out of the hospital and into the mind-body clinic room and has a similar kind of we're Dr. Clark and Dr. Schechter and, Dr. Hanscom. So it's quite interesting to all of us, right, Ishai, when a medical doctor shifts gears.
It's very interesting. It's also just to hear about also the hardships on the way. I mean, I'm sure you underwent all kinds of I don't know, different kind of faces and different kinds of remarks regarding your career. I'm just guessing. I don't know, but it is kind of taking a different path and being committed to that, and I think it's very important for the world and for us in part. Yeah.
Yeah, I mean, as Dr. Sarno said, it isn't alternative medicine. It's just good medicine.
I love it.
And, I mean, everything we do is rooted in science. It's all for the most part, neuroscience.
Mm-hmm.
But, when now we've got research studies, randomized controlled trials showing the efficacy of this work. We've got tons of patient experience, and we've got, good neuroscience on our side. So it's just a matter of time. It's not that when I talk to other doctors about this, in general, they don't criticize and say it's full of crap. They just shake their head and say, yeah, that makes sense. They don't know what to do with it or how to implement it.
Mm-hmm.
But,
maybe you could share with the audience a bit about new studies that came out, a bit about the Boulder or the EATP. I know there's another study that came out recently.
Mm-hmm. Yeah, sure. We the Boulder back pain study was done at the lab of Tor Wager. Tor is one of the top neuroscientists in the world and a specialist on fMRI and pain. And we recruited about 150 people with chronic back pain. The average duration of back pain was 10 years, so people had chronic back pain. And we randomized them to 3 arms. One arm got a placebo back injection. One arm got treatment as usual. And the third arm got our mind-body approach. And so I evaluated 45 of the 50 people randomized to our arm of the study. And of the 45, 43 definitely had absolutely nothing wrong with their back. And so one of the things we found is that when you know how to evaluate people and you look carefully at their pain and their imaging and their life, you can determine with good accuracy whether the pain is coming from their brain or from their back. Mm-hmm. And most chronic pain, it comes from the brain. Most headaches are not due to structural problems in the head, 95%. Fibromyalgia is not due to a structural problem. Chronic abdominal pains, irritable bowel, chronic pelvic pains, these are by and large not due to structural problems. So why would chronic back pain be any different? Anyway, so we treated these 45 people with pain reprocessing therapy done by Alan Gordon and Christy Weepy. and 75% of them were pain-free in 1 month. And all we did was help them to understand that their back wasn't damaged. We helped to lower their fear of pain, lower their fear of movement, lower their fear of being something wrong in their back, and over time teach them techniques to rewire their brain. And this was an amazing study, and now more and more people are finding this type of therapy.
The numbers there are really, really amazing. And it makes me wonder, because it really was like only eight meetings done with those people.
Right.
And the numbers are really astonishing. And it was always a question of mine if it had anything to do with Allan and Christy, or is it the PRT itself? I'm really interested in hearing also in your experience, and also for the audience, is it always that easy, quote unquote?
No.
Right.
No, it's not always that easy.
I think it's important for the people to hear that not everything is so.
We had kind of a dream team, we call it. I'm very experienced in doing this work. Allan and Christy are very experienced in doing this work. There are certain people who, read a book by Dr. Steiner and their pain goes away in a couple of weeks. But that's probably only 10% of people. Most people need more work. Most people need unpacking. Most people have more issues in their life. The group in Boulder, Colorado was a very highly functional group. They were the kind of people who weren't lying around in bed. They were the kind of people who were exercising even though they had back pain. And so it all depends on the population. We did some work in Las Vegas with a very lower socioeconomic population, and the results were good, but not nearly that good. The results from Michael Danino's study at Harvard with chronic back pain, where he used a similar approach, he had a 3-month program, and 64% of those people were pain-free in 3 months. So it's a very high number. 64% is still fantastic for chronic back pain, better than any other back pain study that we've seen in the past. But still, it's not everybody. So what we find is that it's individual. Everyone has to follow their own path and their own kind of journey to get to healing. And some people need more than pain reprocessing therapy. Some people need emotional processing work as well, that we call EAET, Emotional Awareness and Expression Therapy. So, it's hard because a lot of people read about the cure that happens, in 2 weeks, and it's depressing when they're not better in 2 months.
Right.
Well, we learned from you, we learned from, the other specialists, that we have to lower your expectation. Also, what Allan will call outcome independence, he calls it, that we have to, I'll say to a client, what if getting rid of the pain is not a goal? What if calming your brain is the goal? What if having this new habit of knowing, yada, yada, yada. And they're not shocked, but I think they what I come across is they think they're going to fail. They don't believe in themselves, but they get up every morning and brush their teeth. So they get up in the morning, they put a key pot on. So they have a habit. They know it. This is like a new habit to simplify it. Correct?
Yeah, absolutely. I saw a young man this morning who it's every time he gets pain, he goes to these scary thoughts that there's something drastically wrong with him. And there's clearly nothing structurally wrong with him. And we've proven that. And he knows that on an intellectual level. But on an emotional level, he keeps going back to that fear. So, he has the process of learning to train his brain out of fear. And he's going to have to do it like you train a puppy, with kindness and gentleness and persistence and patience. And he'll do it, he'll get there most likely. But, and what it is a lot of people have learned that they are not good enough in their childhood. They've learned somehow that they're not capable, that they can't accomplish things. And so that is also part of the process, because the pain is there as a warning signal that there's something wrong. And if there's something wrong in your life, emotionally speaking, or something wrong in your life in terms of a relationship or work or whatever, there's a message there. So the pain is actually not the problem, it's the solution. And it's hard for people to see that, but when they go through this kind of work, they can begin to see their pain as a gift that's pointing them to become who they need to be or who they want to be or what they need to do in their life. How do they need to treat themselves? How do they need to look at their past? How do they need to look at their work? How do they need to look at their relationships? Some of these things may need to change as part of their, getting better.
Because Rose and I had a show a few weeks ago talking about, I think it was you say, well, 60% of the people get better. But then we had a show to talk about the 40%, and the 40% are exactly in this stuck place where you can even say, like, what's the pain doing for you? It's becoming your friend. It's moved in. I mean, everyone is, it's possible that everybody can heal from chronic pain, but not everybody will heal.
Right. It's hard because it is possible, clearly, but not everyone heals from, anxiety or depression. And it's the same kind of thing. Sometimes there's some things that are very deep and go back to people's lives, and maybe we haven't found the right way. Our way isn't the right way for everybody. There's emerging technologies, obviously, with psychedelic medications used with anxiety, depression, PTSD, chronic pain. That's an area that can help people. There's other types of therapies. We've been using a lot of internal family systems to go along with our emotional awareness and expression therapy work. So the thing is, the main thing I think is for people not to lose hope, to have people continue to have hope, to have optimism that they can get better, because it's true, they can. It just may take a while.
It's chemical when they have the hope. The biology of belief.
Yeah, absolutely. Absolutely.
So I know there's some people that want to ask some questions. So Ariel, if you wanted to ask your question, I know you want me to let you know. I want to make sure that you get all your questions answered before Dr. Howard Schubiner leaves our Israel office, because he's got to fly out on the magic carpet.
Air Force.
So he can not bump into President Biden, who's negotiating our world peace right now. Okay, Ariel, practice your good English and ask.
You can also write it in Hebrew, and I'll be happy to translate it if it's easier.
Okay, yeah, I asked anyone if they need translation. Okay, Ariel, here you go. I read somewhere that during a training you did with Allan, you talked to a woman with post-herpetic neuralgia, which he suffers from in the last 2 years, and you resolved her problem. Does PHN,
post-herpetic neuralgia,
is it all the time TMS?
Yes.
I love it when you just.
And I work with Ariel, and I have so much belief in you, Ariel. I have so much belief in you, and you want to knock me down and make me wrong, but you can get better too. Talk to Ariel for a minute, Dr. Schubiner, please.
Well, what it is that the virus causes the rash and the pain initially because it's affecting the nerves. But the virus, like all viruses, go away. And it doesn't become chronic. What happens is that the pain becomes learned by the brain as a neural circuit in the brain. And that's why the pain can come and go, turn on and off. And I didn't used to think that that post-herpetic neuralgia. I didn't think that it was a mind-body disorder or a neuroplastic pain disorder when I started doing this work almost 20 years ago. But over those 20 years, I've seen many people with it, and I've learned that, yeah, it is a neural circuit. I had one patient who could look at his arm where he had the pain, and he could he could tell his brain, bring it on, and it would come. And he could tell the brain, that's okay, and it would go away. I had one woman who had the pain right on the spot, and she did some emotional processing work in relation to her mom, and the pain went away like that. So it's not to say it won't come back, but the point is that pain that turns on and off like that is neuroplastic. It's not the virus turning on and off.
Thanks. I was wondering if you can elaborate a little bit more about the emotional awareness technique. I know that there's people that, they undergo years of psychotherapy and psychologists, and they come to the clinic and they're, I already discussed my emotions, and what's different in your approach when relating to the chronic pain issue?
Yeah. Well, first of all, what I always tell people is that the steps that I use. The first step is education about the brain and pain neuroscience. Second step, diagnosis and assessment, making sure that the diagnosis is accurate, that it's not a structural problem, that it is a neural circuit problem. Third step is the pain reprocessing therapy. And we think for most people, that's all they need. Not everyone needs the emotional awareness and expression therapy in order to recover from the pain or the other symptoms that might also be neuroplastic, such as fatigue, insomnia, anxiety, depression, tinnitus, etc. So not everybody needs to do the emotional processing work. I think in general, it's not a bad idea to do some of that. And there are some ways of doing it that are simple expressive writing exercises that are in my book and many other people have taught and are using, because it helps to deal with them. Everyone should learn how to deal with emotional issues in their life. Everyone should. Children should. We should all be teaching it. Just like we should be teaching mindfulness to children, we should be teaching emotional processing.
And rather than even just deal, it's like an acceptance. It's like a comfort with what's uncomfortable.
Yeah, well, you have to learn that emotions are not dangerous. Anger is not there's no such thing as a bad emotion. Anger is not a dangerous emotion. Violence is dangerous when anger comes out in the world, but anger itself is not dangerous. Anger is a healthy response to being hurt. Anger means you're protecting yourself. You're standing up for yourself. But what happens is people don't know how to handle anger or what to do with it. And so they just hold it in and bottle it up inside, which ends up some point later in life, oftentimes producing pain or other symptoms, or they displace it. They, get mad at somebody else, or they do violence in the world, which we don't advocate at all. But what emotional awareness and expression therapy is helping people take anger and express it in a safe and healthy way, in a safe and therapeutic way, in writing or in speaking out loud or imagining that anger coming out. If somebody, when there was a guy I always tell the story, a guy in the hospital who yelled and screamed at me in public meeting, I went back to my office and I imagined smashing his head into the desk 100 times. And I felt so much better. I didn't do any damage in the world. I wanted to slash his tires, but that would have been bad.
I would have done that.
But I just imagined smashing his head, and then I laughed. And then I had to do the work of letting go of the anger. You don't want to be hanging on to anger. You want to express it in a safe and healthy way and let it go. And then I had to do the work of taking any sadness that I felt and turning that sadness into compassion and making sure that I didn't feel guilt. So you're dealing with anger and guilt and sadness, and you're taking all that and you're turning it into compassion, because what heals is compassion. And I began to have not only a lot of compassion for myself, which wasn't that hard because my mom taught me that, but also I had compassion for him because everyone knows he's a jerk, Mm-hmm. And there's reasons why he's a jerk. And so I learned to have some amount of pity, some amount of compassion for him so that I could let go. And when you can let go of an emotional situation, then you can free yourself from it. It's not weighing on your mind. It's not weighing on your body with emotional baggage. So that's kind of a description of this process.
That's take home. That's a take home. I call it take home tool, take home insight. Like letting go is actually a form of control, and people don't realize if they could let go, they actually have control. So before we go on, there was just two women that you have helped. I'm not sure if they're in Israel. Gina Myers Siporian, remember that name, and a Galit Greener.
Mm-hmm.
Anyway, well, they're your fans. They might be here in Israel. Um, Gina wants to know if you're ready to translate your books into Hebrew.
Uh, well, I don't have the capacity to do that. I mean, how would I?
Yeah, I remember I was
You may
talking to
have
Dr. Schechter about that, and he was
you may
like,
have the capacity to do that.
what do you think? If somebody wanted to do it.
It's a big job, you know. It's a really big book, and but some I think Dr. Sarno's books are translated into.
Yeah, 30 languages. And
Yeah.
you know who wrote the foreword for Dr. Sarno's book? Dr. Simon Wolfson
Oh, really? Okay.
wrote the
Yeah.
foreword. This is a small world, because I
Yeah.
know that you've met him, and But
Yeah.
well, think about that. Like, I know that a lot of the like John Fredrickson, there's a lot of ISTDP really growing very fast in Israel.
Oh,
And there's a
fantastic.
gentleman who just translated John Fredrickson's book.
Oh, really?
Yeah,
Oh, that's fantastic. Yeah.
yeah. And
Yeah.
so,
Yeah. ISTDP, I was going to mention that is one of the great types of emotional processing therapies.
yes,
And our model has taken a ton from that. And my teacher was Allan Abbass. So I work with Allan,
amazing,
and, he's taught me a ton. So we
amazing.
want to
Well,
make
listen, if we find someone to translate your books and all, we can have another little
Let me know.
business meeting over that. Okay, so Roz Rio it's a big question. I think Roz is in, I think she's Israeli, but she might be in America. Anyway, how can we heal from long COVID? I've tried some of the TMS tricks from Dr. Sarno's books, and some of my allergies decreased. I also suffer from shoulder neck pain many years since teen. I managed to cure with TMS learning. I have very intense tinnitus that is starting to tune down. But how can we help teenagers and also little children so that they can get rid of their TMS symptoms? Wow.
Well, long COVID is everyone needs a good evaluation to make sure they're okay, to make sure that COVID hasn't damaged their heart or lungs. But the vast majority of people with long COVID do not have damaged heart or lungs. The vast majority of people from long COVID have recovered from COVID. They've had mild COVID. A lot of people with long COVID never had COVID in the first place. I'm not making fun of it. It's just like these are mind-body. This is another mind-body condition which has spread worldwide. Is very serious, and I take it very seriously. But I've seen a lot of people, and we've worked with a lot of people with long COVID who've healed and recovered completely by using this model. Because when you look very closely at the symptoms of long COVID, they're the same as the symptoms of so many of the other mind-body disorders that we see, like chronic fatigue syndrome, postural orthostatic tachycardia syndrome, dizziness, tinnitus, headache, can't concentrate, can't focus. I saw a woman a few months ago now who had long COVID, and I saw her for the first visit, and she had loss of smell and taste. She had all these other symptoms. And when I saw her 2 weeks later, she was 80% better. 80% better in just 2 weeks.
What did she do in those 2 weeks?
She applied the simple techniques of knowing that she was okay, knowing that it wasn't the virus, knowing that her symptoms would reverse, she will get better. Every time she got a symptom, she smiled at it. She said, "Oh, I see, that's okay, I'm all right." And she just kept going, and she started doing more. And she was way, way better in such a short time. It's amazing. Not everyone gets better that quickly, as we've just said, but she did. But the interesting thing is that I saw her on a Monday. On Tuesday, she couldn't smell or taste. On Wednesday, she could smell or taste fine. On Thursday, she couldn't smell or taste anymore. On Friday, she could smell and taste again. Her sense of smell and taste turned on and off every other day for a couple of weeks, and then it was fine. I mean, this is amazing. Never underestimate the power of the brain to turn on symptoms that seem so severe, like can't get out of bed with severe fatigue, can't think straight, don't even know how to write my name. These are serious things that people with long COVID and lots of other people have without long COVID and have had for years. And if you read the book by Suzanne O'Sullivan, The Sleeping Beauties, she describes a whole variety of things around the world where your brain can hijack your whole body and turn you into a screaming mess, or turn you into catatonic, like the children in Sweden. So, the brain is very, very powerful. And we have to realize that when we've ruled out a medical condition and we've ruled in a neural circuit condition like this, it is reversible. And, the more people know that, the better we're off we're going to be.
I want to add to that because I've had the privilege of hanging out with Dr. David Hanscom a couple of times. And he just loves to come on the show and talk about it. He said, Tova, is it okay if we change mind body to threat safety? And I said, I think I could agree with that. And so Roz, possibly another way to look at it, because sometimes it is a new language and you have to feel comfortable with this new language, is that what you're experiencing is a threat. And your body keeps experiencing the threat, even though the threat is gone, COVID's done. And so how do you give your body safety? So it feels like you could plug in the same tools with threat safety. You agree with that?
Yeah, it's all about your brain feeling safe or your brain feeling in danger. Are you feeling in danger from your life, from your past, from your pain, from what's going on, in your world? All those things lead to the sense of feeling in danger. And so, the other part of the question was, what do you do with teenagers and children? For children, you have to get them to feel safe. My mother made me feel safe when she sang. Children who are in an unsafe environment are going to have symptoms. It's not their fault. They're not the one who needs fixing. Their environment needs fixing. If they're being bullied, their environment needs fixing. And children can be taught, just like adults can, just to stand up for themselves, to speak their mind, to ask for what they need. Children can have a little board on their room that says things that make me sad, things that make me glad, things that make me mad. And they can learn that they can express themselves. I was with some friends last weekend, and they have a daughter who's about 8 or 9. And, she has a cousin, little baby cousin who's a year old. She loves the cousin. And then she says to the cousin's mom, her aunt, she says, Auntie, that baby's taking up too much time and attention. She was able to speak her mind and say, look, this is too much. It's really great.
Very good. So, Roz, let us know if you feel satisfied with that answer. And the three of us right here with many, many years of experience have full belief, mechus, that you can heal long COVID and anything else. Deborah Bliss said working with your book gave her life back. How many lives have you saved?
I'm not Jesus. I don't save.
I don't know. And anyway, listen,
people heal themselves, right?
I like that.
This is what it is that, I can guide people in the direction. I can point them to the science, I can show them the research, I can help evaluate them from a medical point of view, making sure that they're not in danger. But, they're the ones who do the work. And they're the ones who get the credit because and that's why it's so satisfying, is to be a coach and just help coach people and cheer. I'm like cheerleader, I just cheer on from the sidelines.
We say in Hebrew, you're the shaliach, you're the messenger.
There you go. Yeah, sure.
Yeah, it's kind of a shift in when coming into a doctor's office and the doctor says, I'm just going to teach you what to do, but you have to do the work, and you have to, stand behind and take achrayut, right?
Achrayut, unity.
Not achdut, but achrayut. You have to, take responsibility for
Yeah.
for your actions and for your past and for your emotions and for the way you think and the way you act. You have to take responsibility and you have to do the change and you have to do the work. And a lot of people, they rather, take a pill.
Yeah, it's hard.
It's
It's hard.
difficult.
It's a big responsibility. And, everyone is dealing with the cards that they're dealt, the hand, their life, what happened to them. And a lot of people have really difficult times, It's not their fault that they were born into whatever family they were born into or whatever time or place they were born into and what happened to them. These all leave an imprint on our brain. And, but you're right. It's obviously our responsibility to do the best we can with who we are and where we came from. And that's what's so moving about this is when you see people who can overcome great adversity,
Mhm.
by healing, by being able to face themselves and face their past and learn that they're okay. They can be okay, even though they've suffered, even though they've been through a lot. They can be okay now. And when they stop fearing what's happening in their body and they stop fearing what's happening in their past, part of our treatment is emotional reconsolidation, which means going back to the past to change the past. Well, you can't actually change the past, obviously, but how we know what our past is our memories of the past.
Your experience, Gabriel Mattei says, it's not the trauma, it's your experience, relationship with the trauma. So exactly what you're saying.
Exactly. And we can go back in time and help change the memories because memories are always changing. You can't, memory is not a fixed thing. Memory is a little packets of information in your brain that you fill in the blanks. So it changes every time you remember something. It literally is different. And lots of people, including me, have memories of things that never actually happened, even though we have that memory. And every time you go back and remember something, you're remembering it a little bit differently. And in PTSD, people go back in time and they remember a situation. It gets worse and worse over time. And we're guiding people through this process of going back in time to actually change the memory, to go back in time and visit their younger self and help their younger self be more loved, be safer, be more assertive, do whatever that younger self needs to do to change the emotional memory of what happened. And it's amazing you can do that. And when people change the emotional memory of what happened, they still know that bad things happened to them, but the way they're remembering it now is not as bad.
Mm.
And they can free themselves from the trauma, as you pointed out, of those memories.
In the movie Love Heals, did you get to see the movie Love Heals with Dr. Fred Luskin? Spoke in it with Dr. Hanscom and Bruce.
Lipton?
Yeah,
I don't think I did see it, no.
Anyway, it was a beautiful movie. It's an amazing movie about this girl who had 2 surgeries and healed through the power of love. And Hanscom says that love is awareness. So they interviewed Dr. Fred Luskin, who wrote a book, Forgive for Good.
Mm-hmm.
And I think it's another science of forgiving. And you're pointing to the same. And so I'd like to ask you, there was this Dr. Bethany, I forgot her last name, but she did a podcast on Tell Me About Your Pain. And she's a scientist. She came on our show and she spoke about pain being an emotion. And I want to believe that because it is processed in the same place as fear and anger. So can we say, like on the record, that pain is an emotion?
Yeah, pain is an emotion. An emotion is a physical reaction in the body due to some kind of mental stress or awareness. Excuse me. I feel like I have to sneeze.
Yeah.
No, it's not coming.
Blessings coming your way.
Anyway, so when you have an awareness in your brain of something dangerous, like you look and all of a sudden you see something that looks like a snake on the ground, your body will tense up with anxiety, and then you're aware of the anxiety. So you have the subconscious initial event, you have the physical reaction, and then you have the awareness of that physical reaction that you say, oh, I was frightened. So that's an emotion. Pain is the same thing. When you have a subconscious thing that is alerting you to a danger in your environment, like your boss is really mad at you, and all of a sudden you feel your stomach is turning into knots, and then you're consciously aware, oh, my stomach is upset. So that pain that you have in your stomach is an emotion because it's being triggered by your brain in response to some subconscious threat. Okay, so pain that when you cut your finger, you're likely to get pain. You don't always get pain because your brain decides whether to turn pain on or not, because all pain is derived and generated by the brain. But when you cut your finger, the nerve signals go to the brain. The brain responds with a reaction to cause you consciously to feel pain. So you move your finger and stop cutting yourself or stop burning yourself or whatever it is. So pain is an emotion. That's a fact.
Beautiful. I really am happy. I didn't hear it for a long time in my studies until this woman came on, but it's interesting. So there are two questions that I want to make sure we get answered. Roz responded, thank you. She knows she's on the right path, appreciates the knowledge. She hopes someday to learn to be able to help others overcome, which Dr. Sarno recommended that. He said, go and help others. That'll help you. So smart, Roz. Is there training available through Dr. Schubiner or something like being a coach or a psychology degree? Does that without having? Yes, I'll send it to you, Roz. I have you on as a friend on Facebook. I'll send you Dr. Schubiner's your newsletter came out with a number of great courses you're teaching.
Yeah,
so I will send you that. Yeah, and Ariel is the one with the
post-operative neuralgia.
Yeah, and one of the keys in TMS is to accept the symptoms and being indifferent to them. Anyway, what can we do if the symptoms are too overwhelming? It's a good question, Ariel.
Yeah, it's hard because pain is designed to alert us, to alarm us. A smoke alarm is designed to alert us in the same way, and a smoke alarm has to be loud, so otherwise it won't alert us. Similarly, the pain has to be severe enough to get your attention. That's the role of the brain, to make it that severe. So it's important to understand that the severity of the pain is not related to the cause of the pain. Mind-body pain or neuroplastic pain can be every bit as severe as the most severe pain ever. And sometimes when the pain is very severe, you have to just stop and take a medication or rest or do something to just help yourself get over it in the short term. But nevertheless, you still have to understand what's causing it. It's not always easy to be indifferent to it. It's not always easy to smile at it. But over time, you will learn and you will teach yourself to realize that when the sensations occur, you can tell yourself that I'm okay, even though it hurts a lot. You can tell yourself, I'm actually okay. This is my brain. I know what this is, and I know that this is temporary. I know that this will pass. I know that I'm okay. I know that I'll be okay. And what you're doing then is you're lowering the fear. And every time you lower the fear, even if the pain doesn't change, or if it gets worse, or it doesn't go away, that's not what matters. What matters is you're investing in lowering that fear response little by little over time. And over time, you will succeed.
Excellent.
Yeah,
Anything to add to that? To Ariel, Ishai?
Yeah, if I could just add to that, is what I also tell people is really you're in a training. It's really just training your mind, and some people can do 2 push-ups at day 1 and can do 10 push-ups at day 2, and the other person can do 15 on day 1 and 50 on day 2. So it really depends. You're training your mind. You're training it to think differently about the pain, about the origin about the pain, about your response to the pain. So that's what I always keep on telling. Just keep with the training, keep on the path, and slowly but surely.
Wonderful. So I know I'm taking care of you, which is my maternal instinct. So I want you to be able to have a break because I know you work hard, and I see you interview with lots of people. You're very special to give your time. So I know we appreciate it. I know Ishai and I appreciate it. And if there's anything we can ever do for you across the sea here, we're here. If you need to get a book translated or something, I don't know, we'd like to be involved with you and your work. And we're happy that you're connected to Haifa University and the Pain Lab with Pavel Goldstein. And actually, I would like to do a little plug for Ishai and I. After September, when I take the PRT course with Alan Gordon, Ishai and I will be the only people in Israel that will be certified with that work. And I'm very excited to do some workshops and give people the tools. You know, there's a lot of knowledge, and we fill our heads with up here, and then we don't get to the unconscious. So I'm happy to be doing some work with Ishai and helping people practice, apply, implement, because that's the game. Stop being a spectator and get into the game like John Sarno with 2 feet. Remember, it's coming out of his Monday night lecture. Jump in with 2 feet, you would say.
Yeah. Dr. Sarno was great. He taught me a lot, and I've always really appreciated his groundbreaking work because he really had much more headwinds coming against him. And his wish was that this work would be accepted into modern mainstream medicine in his lifetime, and that didn't happen. And it may not even happen in my
It's a
lifetime.
little bit like Elvis, isn't it? I'm selling so many all the rage movies here in Israel for $5 with Hebrew subtitles. Everyone's watching This Might Hurt from Ishai. Like we're promoting it because now I was the one who got the Hebrew subtitles for that.
Nice.
And the movies are phenomenal education and inspiration. Thank you for that one also. And I think he's getting his say in court, don't you think?
Oh yeah, you can't keep a good idea down forever. And Victor Hugo said, "There's nothing more powerful than a good idea whose time has come."
Yeah.
And so, it's really persistence. It's the same thing that I was saying to Ariel and to Adriana, who has a question about that. It's persistence. It's not making it that hard. Sometimes people try too hard. They spend their whole life trying to get better, trying to fix the problem, and trying to keep doing more and more writing, more and more everything. But really, the main thing is to really live your life. The main thing is to live your life with as much joy and calmness and happiness as you can, with as much laughter as you can, because that's what trains the brain that you're safe, that you're safe. And so, one of the things this work has taught me is to be patient, because when I first discovered it, I thought it was so amazing. I thought everyone would just immediately see how powerful it is and would immediately change all their practices and do this work. And that didn't happen. But it's little by little. It's people like the two of you in Israel. It's people like all the people around that email me from all over the world and all over the States saying, "Hey, I found out about this. This makes help. How can I help others? And how can I tell other people about it?" Somebody said, I'm giving your, she's a woman with an amputation. She's in an amputee for 27 years, and she's had pain in the stump area where the amputation was for 27 years. And she's getting better now for the first time. And she says, she said to me, "I'm giving your name out like Halloween treats on Trick or Treat."
Ishai, can you answer Galit's question? Is it for you? It's in Hebrew.
כן, אני מקבל בארץ, אפשר לקבל את הפרטים דרך טובה.
Oh, okay, wonderful. So listen, I hope to have you back again. I'd like bringing my colleagues into this Israel studio. We're international here, and there's no Howard Schubiner here. And you told me your daughter came here, and now it's your turn. And you were supposed to come before COVID, remember?
I know.
What about you and your wife? Would you travel here for a treat? Don't listen to the news, by the way. Don't trust the news.
We're starting to travel, so hopefully that'll be the case soon. Thank you very much.
Yes, you're welcome. It's very holy here, and we have tour guides called Ishai and Tova. And
Good to know.
all right, listen. Thank you so much. Bless your heart, your big heart, and bless your mother. Is she alive? Your mother?
No.
Oh well, her soul's dancing around.
Yeah, she would be happy.
Yeah. Ishai, you want to say anything?
I just want to thank you really for the work you do, and you probably get this a lot. Also for being just being there and being it's very optional to just talk and get your advice about questions, and I really appreciate your devoting your life to this, and I find that very I look up to that, and I appreciate it. So thank you for your time. It was a pleasure.
Thank you. I still find time to play golf.
Yeah, in the cup. And then your favorite thing to do is to make the milk and the coffee from the movie. So I see you. I see you relaxing. You have to know balance to do what you do. You have to be a role model.
Yeah.
So I'm happy that you said that. I'm not going to worry about you anymore.
Don't worry about me.
Okay. Thank you so very much. So if we can help in any way, lighten your load, we're here.
I'm starting the translation right now.
Let's do it.
Thank you. That'll be awesome. I'll be happy to work with you on that.
And have a wonderful afternoon. Stay
Thanks.
well.
Okay. Bye-bye.
All the best.
Take care.
Bye.